How do you differentiate different infections? I'll show you. Let's dive in. So you're presented with a patient showing flu-like symptoms. You know, fevers, myalgias, and malaise. It sounds viral, right? But what if they also have delirium and altered mental status, plus salivation and sweating, plus mydriasis, then facial nerve dysfunction and coma, and you're given raccoons, skunks, bats, foxes, or coyotes? Yes, think rabies. Rabies is a viral infection that replicates in the muscles, then spreads through the peripheral nerves up to the central nervous system. It can accel from 12 to 100 millimeters per day. Rabies is 100% fatal once it reaches the central nervous system, so the key is prevention. The incubation period for rabies is classically 30 to 60 days. The main principle when dealing with rabies post-exposure prophylaxis, or PEP. You need to know how and when to give PEP. In general, there are 3 parts to PEP. 1. Scrub the wound edges. This is 90 to 100% effective if done within 3 hours. It's generally recommended to use an iodine-based solution. 2. Provide active immunization with the HDCV vaccine. Classically, this is given in the deltoid in the adult and in the thigh in the baby. Currently, the CDC recommends to give it on day 0, 3, 7, and 14. 3. Provide passive immunization with the HRIG immunoglobulin. This should be given at the site of the bite and at a site distant from the bite. The benefit of giving PEP in pregnancy generally outweighs the risk of giving this treatment. Traditionally, post-PEP viral titers are only obtained in immunosuppressed patients, patients on steroids, and patients on anti-malarial therapy. In general, lagomorphs and small rodents are considered low risk for rabies. PEP is not usually given in these situations. Wild animal contact is considered high risk for rabies. PEP is usually recommended in these cases. Raccoons, skunks, and bats are specifically associated with high risk of rabies in the United States. A special note that's often taught is, if a bat is found in the room of a sleeping baby or a patient with dementia, it is suggested to consider that contact has occurred and PEP is usually recommended. As for domestic animal bites and contact, it depends on the context. There is an algorithm for this that depends on whether or not the animal is captured and what the animal is behaving like. It's always good to review this algorithm before an exam or before taking care of a patient that might have come in contact with the rabies virus. What if you're given an elderly patient or an immigrant or an IV drug user or a patient with chronic wounds like a decubitus ulcer and trismus plus twitching plus a tense face plus tonic-clonic contractions, then elevated blood pressure, elevated heart rate, and an elevated temperature? Yes, think tetanus. Tetanus from a bacterium Clostridium tetani causes a systemic intoxication with the tetanus toxin that leads to a rigid paralysis. There are many principles of treatment for tetanus. You need to protect the airway. You need to relax the muscles. You need to control autonomic dysfunction. You need to find and debride the wound. You need to give both active and passive immunization, the HTIG and the tetanus toxoid respectively. You need to give an antibiotic that is active against anaerobic bacteria. Classically, this has been Flagyl. Historically, it was taught to avoid penicillin because that can make the muscle contractions worse. You should review the most recent guidelines for vaccination of when and when not to give the tetanus vaccination in people who have had a cut in the skin. What if you're given flu-like symptoms plus a sore throat plus a pseudomembrane on the tonsils plus a bull neck? That's right, think diphtheria. Diphtheria causes a local infection and a systemic intoxication. Locally, it can cause airway obstruction with the pseudomembrane. Systemically, it often causes myocarditis and a peripheral neuropathy. Diphtheria is classically treated with antibiotics and the diphtheria antitoxin. Remember, I'm just reporting, not recommending. So put your flamethrowers away. Every patient, context, and test question is different. The tests and treatments of choice change over time, so please use the most up-to-date current literature. Here is a more detailed disclaimer. Don't forget to like and subscribe for more Bucketology content.